Okay, so let's talk about the Norma Basalis today. The Norma Basalis is when you're looking at the base of the skull with the mandible removed, right? So you're looking at the base of the skull, the mandible has been removed, and you're looking at it from the bottom. Now, just for studying purposes, this has been divided into three parts. An anterior part, this part is limited to this posterior margin of the hard palate, right? So this forms the boundary of the posterior boundary of the anterior part of the Norma Basalis. From here is the beginning of the middle part of the Norma Basalis, and it lies till this part here, an imaginary line just anterior to the two occipital condyles, right? So from here to here you have the middle part. Anterior to this posterior margin of the hard palate is the anterior part, and behind this imaginary line is the posterior part of the Norma Basalis. Now the key features of the anterior part of the Norma Basalis, this is the alveolar arch which bears the sockets for the teeth. This is the hard palate. The hard palate is formed by the maxilla and the palatine bone. So anterior 2/3 is by the palatine process of the maxilla, and the posterior 1/3 by the horizontal plate of the palatine bone. In between the two palatine processes is the interpalatine suture. In between the two maxillae is the intermaxillary suture, and in between the maxilla and the palatine bone you have the palatomaxillary suture. And as a result of all of these, you have the cruciform suture, which forms a cross, right? Now this is the incisive fossa, or the incisive foramen, within which you're going to have the two incisive canals. Then this part here, this foramen here, is the greater palatine foramen, and just posterior to that, in the pyramidal part of the palatine bone, you're going to have the lesser palatine foramina, which may be 2 or up to 3 in number on each side, right? And then here in the middle, you have the posterior nasal spine, and this is the posterior margin of the hard palate, and here you're going to have the palatine crests. All right, moving on to the middle part of the Norma Basalis. Now the middle part of the Norma Basalis, let's bring it a little closer so hopefully you can see it better. Now in the middle, we have the central part here in the median plane. Now this is a broad bar of bone, right, which is formed anteriorly by the body of the sphenoid, and posteriorly is the basiocciput, right? And this has a tubercle, which is known as the pharyngeal tubercle, and multiple pits for the palatine tonsils. Anteriorly you have the vomer, which is forming the bony septum, and then widening of the vomer to form the ala of the vomer, right? Now these are the posterior nasal apertures. This thing here is on each side is the pterygoid process. Now this is part of the sphenoid bone. So the pterygoid process then has two plates. This is the lateral pterygoid plate, and this is the medial pterygoid plate. Now if I replace this with an artificial skull, as you can see here, you can see that the lateral pterygoid plate is much larger and the medial one is smaller in size, right? So this is the vomer, the ala of the vomer, and the pterygoid process, right? So the lateral pterygoid plate, right, back to this, the lateral pterygoid plate is also forming the medial boundary of the infratemporal fossa. Now in between the medial and the lateral pterygoid plate, this is the lateral and this is the medial pterygoid plate. In between these two, this is the pterygoid fossa, and here you can see the pterygoid fossa on this side as well, right? And then this is the medial pterygoid plate, and this splits to form the scaphoid fossa here, right? And then superiorly, the medial pterygoid plate forms the pterygoid hamulus. All right. Medially, the medial pterygoid plate forms a process which is known as the vaginal process of the medial pterygoid plate, or the vaginal process of the sphenoid bone. Now between the vomer and the vaginal process of the sphenoid, you have the vomerovaginal canal, and between the sphenoid process of the palatine bone, I can't show you here, but between so it's a bit anteriorly, and between these the vaginal process of the medial pterygoid and the sphenoid process of the palatine bone, you have the palatinovaginal canal, which opens into the pterygopalatine fossa. All right, moving on to the different parts of the sphenoid bone. We've talked about the pterygoid process, and let's talk about the greater wing of the sphenoid. So this is the greater wing of the sphenoid within the Norma Basalis. It forms a pentagonal shape. So there are 5 sides to it. Anteriorly, it is bounded by the inferior orbital fissure. On the lateral side, anteriorly, the infratemporal crest. Posteriorly, on the lateral side, is where it is attached to the squamous part of the temporal bone, right? On the medial side, again, you have the anterior and the posterior part. So anteromedially and posteromedially. Posteromedially is where you have the border with the petrous part of the temporal bone. So this is the petrous part of the temporal bone, and this is the posteromedial border, right? And the anteromedial border is with the lateral pterygoid plate. Okay. Then let's move on to, so we can see that here as well, the pentagon, right? Anteriorly, anteromedially, posteromedially, posterolaterally, and anterolaterally, right? Okay, so then we have the petrous part of the temporal bone. We'll talk about the various parts of the temporal bone. So this is the petrous part of the temporal bone, right? Here you have the foramen lacerum, right? And this part here, at the junction of the posteromedial border of this pentagonal part of the greater wing of the sphenoid and the petrous part of the temporal bone, here you have 2 foramina. You can't see it here, but you can see it here on this side. So this one here is the foramen ovale, and this is the foramen spinosum. This is called the foramen spinosum because it is right next to the spine of the sphenoid, right? So this one is, this is the foramen spinosum, and then this one is the foramen ovale. All right. Okay. So moving on to, we were talking about the petrous part of the temporal bone. At the apex of that, you have the foramen lacerum here, right? So this is the foramen lacerum, and then this is the carotid canal, right? So this is the carotid canal through which you have the passage of the internal carotid artery, right? And this is the spine of the sphenoid, right? Just posterior to the foramen spinosum, you have the spine of the sphenoid, this. All right, moving on to the squamous part of the temporal bone. This is the zygomatic arch, right? So this is the contribution by the temporal bone, the zygomatic process of the temporal bone. So this is the zygomatic arch. The 2 roots of the zygomatic arch, the anterior and the posterior root, within which you have the condylar fossa. Posteriorly, it is bound by the tympanic plate, which is also forming the anterior, the inferior, and a bit of the posterior wall of the external acoustic meatus. This is the external acoustic meatus right here, right? So then we have the foramina that we've talked about are the foramen ovale, the foramen spinosum, the foramen lacerum. We've also talked about this carotid canal. Now, in addition to that, here you can also see, now the styloid process cannot be seen here, but this is the styloid process, right? So that would be the one here. Let me bring the other skull. Okay, so let's go over these foramina here as well. So we've talked about, let's go over because it's a bit more clear. It's a bit more easy to understand these structures on this skull. So the pterygoid process, the lateral pterygoid plate and the medial pterygoid plate. In the middle, you have the vomer, the ala of the vomer. Here, you have the basiocciput and the body of the sphenoid forming this broad bar of bone, and this is going to be the pharyngeal tubercle. This is the foramen ovale, right? And then this is supposed to be the foramen spinosum, right? And then this is the foramen lacerum here, right? This is the petrous part of the temporal bone. And here you can see that the styloid process is intact, right? So this is the styloid process, which you couldn't see on the other bone because it was broken. And then here you can see the condylar fossa, where you have the ramus of the mandible. The condyle, which is present on the ramus of the mandible, forms the temporomandibular joint here in this condylar fossa. And posterior to that, you have the tympanic plate. And this is the external acoustic meatus. All right. Okay. In addition to that, we also have, so let's move on to the posterior part, right? So the posterior part, which, let's shift back to the other skull. All right, so in the posterior part of the Norma Basalis, these are the two occipital condyles, and this is the foramen magnum, right? Through these occipital condyles, you can see this is the hypoglossal canal. I don't know if you can see it, but this is the hypoglossal canal, right? So anteriorly, passing through these occipital condyles, you're going to have the hypoglossal canal. All right, and then in the posterior part, we talked about the styloid processes. You can't see them here, but this is the styloid process, and just behind the styloid process, here is a foramen, which is between the styloid process and the mastoid process, right? So this mastoid process and this is the styloid process. In between these two, you have a foramen which is known as the stylomastoid foramen. All right, and this is the posterior condylar canal. This right here is going to be the posterior condylar canal. Now, the posterior boundary of the Norma Basalis is marked by this external occipital protuberance right here, this one, and you have the two superior nuchal lines, right? And then you have the external occipital crest, and you're going to have the inferior nuchal lines. And so the boundary, like we were just discussing, of the Norma Basalis, the posterior boundary is by these superior nuchal lines and the external occipital protuberance. Now, after that, you have the beginning of the Norma occipitalis, right? And so these are the mastoid foramina posterior to the mastoid process. And one more thing that we haven't discussed, I think we need to talk about this, super important. This is the jugular foramen, right? So this is the jugular foramen, right? This is the occipital bone, this is the temporal bone, the petrous part of the temporal bone anteriorly. In between these two, you can see this is the jugular foramen through which the internal jugular vein passes. Right, so the two occipital condyles, the styloid process, the mastoid process, the stylomastoid foramen. These are the jugular foramina on each side, one on each side. And then the hypoglossal canal passes through the condyles, the posterior condylar foramen, the external occipital protuberance, this one here, superior nuchal lines, the external occipital crest, and then the inferior nuchal line.